Okay, I think here we go. I think we're at just about time, so I'm hoping that people are trickling in. Hello and welcome to FormFest 2024. My name is Harold Moore, he, him pronouns. I'm the director of the Opportunity Project for Cities at the Beck Center for Social Impact and Innovation at Georgetown University. You can learn more about our work in the link in the chat. Feel free to say hello in the chat with your name and where you're joining us from. We'll use the Q&A function for questions, which you can find on the right side of your screen. Please add them as you think of them. I will ask them aloud for our speakers during the recording during our Q&A session at the end of this section. We're going to dive right into our sessions. Our speakers will introduce themselves briefly, and you can check out their full bios by clicking on their speaker profiles. We also encourage you to connect with them via LinkedIn. Each presenter group will have about 25 minutes to present, leaving us with about 10 minutes at the end for questions. Again, welcome to FormFest. I'm going to turn it over to Becky, Katrina, and Marci. Welcome, y'all.
All right, everyone, thanks for joining us here. We're so excited to be with you for our panel on using kinship caregiver assessment forms as a vehicle for culture change within the child welfare system. Today, you're going to hear from Becky Rice, the Resource Family Ombuds for the state of Maryland, who sits in their central office, and Marci Littman, the Program Manager for Resource Homes in Baltimore City. And they both work for Maryland's Department of Social Services. Combined, they have over 50 years of service working for kinship and foster families, aka resource families. And I'm Katrina Lanahan. I'm a senior user experience researcher at Bloomworks. And Bloom is a woman-owned public benefit company that helps governments and nonprofits meet users' digital service needs. All right, so we're going to start with a little background and where this all started. In September 2023, a new federal rule from the Administration for Children and Families allowed state and tribal child welfare agencies to create specific foster home licensing standards for kinship caregivers for the first time. Becky, can you share a little bit about who kinship caregivers are and how they're different from traditional foster families?
Absolutely, Katrina. So kinship caregivers are relatives who are caring for children who are in foster care. They are often aunts, uncles, grandparents, cousins, sometimes older siblings. And they're also family by choice. So family members who aren't connected by blood, but are connected through maybe godparents, soccer coaches, teachers, neighbors, friends. One thing that makes kinship caregivers different from our traditional foster parent is that kinship caregivers don't typically have a lot of time to prepare. They also tend to be from marginalized communities and need more support. So we are excited to be here today to talk about how we are changing our practice in Maryland.
And can you tell us a little bit more about licensing and why that's critical?
Yes. So licensing is really important because this is how kinship caregivers and foster parents receive what's called a monthly care stipend. And that is the financial support that they need to meet the needs of the children. And if we can't license kinship caregivers, we can't give them that support. And that is what helps make them stable.
Right.
It's really surprising, but only 25% of kinship caregivers who are caring for kids in care in Maryland are licensed, which means that only 25% of them are receiving the monthly care stipend. And that leaves the other 75% who, because of a very cumbersome process, are not licensed and are not receiving that support.
It's really huge. So what this all means, the new federal rule that I just mentioned a couple of minutes ago provides an opportunity to change the game and enable more kinship families to be approved and licensed to get those foster care stipends with more trust, transparency, and collaboration. And so Bloom was tasked with developing an assessment form specific to kinship caregivers. And we created a template that agencies like Maryland are adapting and using to license kinship caregivers. We worked with dozens of kinship caregivers in over 50 state and tribal child welfare agencies across the country. So it was designed to be a sort of national template that anyone could implement. And we vetted it with national organizations that included Generations United's Grand Families and Kinship Support Network, the American Bar Association's Center on Children and Family, and Think of Us, lots more. And now this new kinship caregiver assessment is being adapted and piloted in several places across the country, including Baltimore City, Maryland, with support and direction from those national partners. So Marci, let's get into it. Can you talk to us about what pain points you were hoping to address when you all elected to pilot this new kinship caregiver assessment form in Baltimore? Oh, and you're on mute. Come off mute.
I do that all the time. So like Becky said, licensing equals financial support. And for so long, at least as long as I've been doing this for 30 some years, the practice of licensing has always equated to the same thing for both restricted and unrestricted families, right? And as you can imagine, there is a different set of circumstances that exist for both types of caregivers. And so for our kin families, it's really about the experience. And so we want to be able to address our kin families from a perspective of how can we support you? How can we help you? So if you think about what they're going through when a child is placed with them, it's emergent. And at the same time that a family is finding space to put another child in their home, they're navigating and rearranging difficult relationships with their families. They have to go to court. They have to enroll the child in school. There's just a plethora of things that they have to do right away. And at the same time, my program and many others come in and say, well, we need for you to be licensed, which means that you have to jump through X, Y, and Z hoops. And just to give you a little bit of an overview, it includes things like 27 hours of training, again, at the same time that the child was just placed, scheduling medicals for every household member, a fire and health inspection from a community partner, which means taking off of work half of a day at least for each one of those separate appointments, intrusive interviews from caseworkers that question motivations, why people want to become a foster parent, which of course does not apply for a kid. You want to be a foster parent because we asked you in the middle of the night, likely, to take this child that is related to you and to please just move everything aside. And at the same time, our old standard was to ask this family to also go through the standard licensing process. And the issue with that is if you didn't pass those standards, then you were denied and you didn't receive that additional stipend. But here's the kicker. The child still remained in the home. We just weren't allowed by law to license that family, give them the support that they needed. And again, there was no safety issue that precluded the child from being able to remain in the home. So I could talk for hours, but that's just the overview of what we were really excited about addressing through this pilot.
Great, thank you. Okay, so Becky, let's get into the forms. What did they look like before this pilot happened, and what are they looking like now?
So the forms were a bit of a mess. They were outdated. They didn't match our policy and our practice. And we are really excited because we've been able to adapt the national standards, the national questions, from a question bank to Maryland, to meet the needs of our kinship caregivers, but to also make sure that it's in line with our regulations and our policy and our practice. We consolidated many forms into one form, and that alone is huge. It's going to be easier for staff, for social workers to review with kinship caregivers, and it's going to be a lot easier for kinship caregivers. And they will also have the ability to go back and kind of review one form versus, trying to find, 4 or 5 that we currently, make them sign. We also created a form that's going to be uniform across the state of Maryland. And that's one of the things that I'm personally most excited about, because it means that we're going to be able to assess and license and support kinship caregivers across the entire state in the same way. So we should no longer have, certain, jurisdictions, certain counties, assessing kinship caregivers using one form and maybe different standards. And really, really excited about having good forms, but also, uniform documents. And it also eliminated the need for us to contract with some of our outside partners, because we were able to create forms with the help of the national team in Bloom that will allow us to conduct some of those assessments that we have been relying on outside community agencies for years. And like Marci said, that would involve, caregivers having to take off, a couple extra days from work, which is a huge barrier. You will see that we removed questions. Thanks, Katrina. I'm jumping ahead. Very excited. So we really looked at the questions that we were asking. We removed some, we added some, but some of the questions that we removed were questions that didn't really provide our kinship caregivers with the respect and dignity that they deserve. So there were questions that, the social worker had to literally rate their the housekeeping, whether it was excellent, very good, good, fair, or poor. And that's not a safety issue. There are ways that we can capture safety issues related to, the house condition without asking, how is your house cleaning? That's judgmental and not necessary for what we are actually looking at. There were also questions on this form that says animal waste. Is animal waste in the home? And when we looked at our other forms, that wasn't a question that we had on all of our other forms. It was something that was on some of our kinship caregiver forms. And we're able to capture, concerns, about animal waste without literally saying animal waste. So we use different language, is there debris, is there trash, things like that in the home that would, cause a safety issue. And even things like water temperature. We need to make sure that, water is running, that there aren't issues, that it's safe, but we don't need to measure, we don't need to take the temperature of water. We need to make sure that, if we turn it on and it's scalding, we're going to address that issue. But just removing some of these barriers and trying to be a little bit more reasonable is what we are working on. So what you're looking at now is a section of our old form. What we have done, we have added some questions. So we've removed some barriers, and then we've added some things that really get at child safety. So we have added, questions about the conditions of the home that are specific to child safety. One of my favorite things, it's very small, but the second question is the home free of broken steps, doors, or windows that would cause a safety concern. The previous form didn't have the would cause a safety concern. We added that because there could be, a hole in the wall. There could be, a broken step or a corner of a broken step, but that's not necessarily a safety concern. It may not look as nice as we want it to, but we need to get out of that mindset and really look at, is it safe and appropriate? Because if it's safe and appropriate, we want to keep kids with their relatives and with their caregivers and with people that they know. And truly, just by changing some of the language there and making it like specific to child safety, we're going to be able to place more kids with relatives and keep them with relatives and give them the financial support that they need and deserve. We've also asked questions about family relationships. We want to make sure that it's not just about assessing their home, that it's truly about assessing them as humans, treating them with dignity, recognizing that, sometimes there are complicated and complex relationships. But, we've asked, what is your relationship to the child? And we have added in Maryland, we're making it very, very clear that we have what's considered family by choice. And those are, part of our family, part of our kin, but not by a blood relation. We're also asking questions about the relationship and bond, with the children, as well as the relationship or bond with the children's parents or guardians. Those things are critical for us to assess to make sure that the child is going to be safe and comfortable, that the caregiver is going to be in a position to provide them with the care that they need. And because the goal of foster care is reunification, that last question that gets at what is the relationship like with the parents, that's really getting into what is going to meet the needs of the child. We also added questions about what supports the caregivers need. My favorite part of this entire form is the section that says, if no, what is needed to support the family? Just adding that language takes this assessment from being more of like a pass fail to a full assessment, a collaboration, with the Department of Social Services and the caregiver. So, if no, what is needed to support the family? And then we even have examples of items that the family may need to meet that specific area. So this section of the form talks about sleeping arrangements for children in care. Do the children, have a safe sleeping area, with bedding? And then, we talk about on the other side, okay, these are things that if they don't exist, because again, this could be in the middle of the night, this could be without any preparation, we can figure out what the department, what DSS can do to help that caregiver, what community agencies exist that could maybe provide some of those items like sheets and blankets. So it's really about wrapping around the family, figuring out how we can make this work versus, that pass fail. We are also looking at the communication needs and preferences. And this is one of the first sections, one of the first questions, because we want to set the stage, not only for our staff who are training to use these new forms, but we also want to be able to show our kinship caregivers that this is about meeting them where they are. And from the very beginning, it is about them and about helping them and not all about, all about the social workers who are coming in and trying to do this. We really want to meet them where they are, communicate with them, how they want to be communicated with. And we're excited about just that too, because that's part of how these forms are truly changing the culture. And I got excited and I jumped it, but the no longer pass fail. This is huge because this is going to have the biggest impact on our ability to place more children with kinship caregivers and to be able to license them so they can receive that financial support. But we also added a section about follow-up that's needed because since this is no longer like a pass fail, everything has to be perfect this day. There are going to be some items that are on the form that we have to check off, and then we have to write a couple sentences about what the follow-up is going to be. So if we go out to a home and there is a broken window, and it may not be a safety issue, but it's something that we want to help them address so it doesn't become worse and become a safety issue in the future, we're going to document on the form the follow-up that is needed. We're going to communicate that with the kinship caregivers, and then we will be able to document how that was resolved. And all of that can be done while we are, still working with the kinship caregivers on that very initial part.
Great. Thank you, Becky. Marci, can you briefly share how your practice has changed since you've piloted the form?
Absolutely. So like Becky said, we went from an evaluation to collaboration with our providers. Our practice was compliance driven, and now it's supportive. It was a decision driven licensing process. If you did this, then you were licensed. If no, then you weren't licensed and you didn't get the stipend. And we moved from this decision making, yes or no, to how can we support you? Like Becky said, if the question is, no, and this is something that needs to be rectified, say there's, like she said, a broken window or something, it doesn't preclude the family from being able to be licensed. And so these forms also really help guide staff through the process. We are also able to help our staff adjust to this new way of thinking and doing by helping them. If we're not going to have the inspector, the fire inspector and the health inspector come out and do these inspections, which they've been doing forever, we need to be able to make sure that our staff have the tools and the confidence to be able to go in and do what needs to be done to do a safety assessment. And here's the thing, they've been doing it all along. We just also paid outside community partners to go in and really disrupt people's lives. And so it changed the relationship we have with our partners, because now they also are not going in and saying, oh, well, this isn't going to pass. And, they are going in this collaborative form, and they're able to help the families rectify the situations that their house may, again, this is something that's not unusual for our families to need supports. And so we're able to do that as opposed to just, going in there, assessing, saying it doesn't pass, and really just kind of moving along. This whole process for our kin has really changed, but the forms drive this practice, and they really help to give our staff the confidence that they need, that they can do this work.
Great. And what about, you started to say a little bit about your team, but can you share more about how the teams reacted? How are you working with them through this change? This is a huge change for everyone.
Yeah, so this is really a paradigm shift, because when our staff is really used to going into a family's home, regardless if they're relatives and the child's already there, or this is not a social work term, but a stranger off the street who wants to care for the most vulnerable population in Baltimore City, which are foster children. And so those assessments should be very, very, very different, right? And they've never have been, at least in all of my years of practice, because it wasn't until this last November that the laws changed. And so as we've been piloting these changes that will go live statewide in December, very, very soon, like a couple days, right? We are, the families and the team is just so excited. We've had people that were retiring, and because this was all going live and Baltimore City had the chance to pilot, they stayed on because they really, really believe in the work and the need for our kin families to be treated really with respect. And Becky was really nice when she said there's a lot of forms. I counted right before this. We went from 30 forms to 3. And so it is amazing. And again, like she said, all the jurisdictions, I represent one of the locals, the biggest local, but we all have different forms, which means we all have different processes, which means the families experience something different each time. And that shouldn't be happening, especially when things are dictated by state laws. And so that's really one of the biggest adjustments. But we can license kin in a matter of days, as opposed to 3 months, which is how long a home study takes in Baltimore City. And so it has really, really changed the game for our team.
That is fantastic to hear. And speaking of kinship caregivers and how this is affecting them, what are you hearing from them about their experiences with the new
So this is
forms?
the most exciting part of piloting this, is that when we started piloting, we were still licensing kin under the old standards, right? And which means that we denied, and in Baltimore City, that's 50%. We've denied, that sounds harsh, but the standards, the licensing standards are pretty stringent, right? And so we license about 50%, both kin and unrestricted. And so we were able to, and so going through the process, we had to deny because that's what the standards were. As we piloted the new standards that are coming out, we were able to go back to those families under the new licensing standard using the new forms and license them. Because guess what? The children were still there and they still needed the financial help. Everything was the same, except we weren't giving them the financial support that they needed. So I can tell you firsthand that has been the most exciting part for our caregivers. They have been more than elated to be able to receive the stipend and the extra support. And we're doing what we say. Like we're walking the walk that we're talking, and that makes such a big difference too. Like our families trust us because we're saying, please take these children, they're your families, and then we're saying, nope, we can't help you because you didn't pass the standards. And so again, the messaging to our kin that we are partners and that we really do want to support you, it's in line with how we know best practice and how it feels in our hearts, and why our staff stayed beyond retirement to see this through, because it was such a necessary change. And so for all of those reasons, everybody is so excited.
That's amazing. Okay, very quickly in 1 minute, Becky, can you share what you've learned from the pilot?
Yes, absolutely. It's that it takes a team. The national team that we worked with, and Bloom and everybody on the slide that you showed previously, the organizations made this possible, and made this possible to do quickly, because we didn't have to create the questions from scratch. You had talked to different caregivers and child welfare staff from across the country to develop the questions. So we felt confident about the questions and our ability to tweak them to meet the needs here in Maryland. And the other part is that kinship caregivers have a ton of feedback that they want to provide. These forms are for them, they are about them, and we need to continue to value the people who we are developing forms about getting their feedback. They have more to say than I think I ever could have imagined. And we've been able to make the forms even more streamlined because of their feedback.
That is amazing. I'm so happy to hear that. I'm going to close us out here because I think we're just about at time. Thank you, Becky and Marci, for sharing your experiences. It has been incredible to learn about how fast your team has been able to implement this new form and all the changes that you've undergone. And now that it's going to go statewide, it's just wonderful. For anyone curious, if you'd like to see the form template and the standards for kinship caregivers that Becky and Marci have been basing their work on, that's the link here, and we can also drop it in the chat for you all. Thank you so much, and we're going to turn it back over to you, Harold.
Thank you so much. What a fascinating work that you all did. Thank you so much for your presentation as well. A reminder that we're going to take questions from the Q&A after the next presentation. So keep those questions coming in the attendee hub. Now it's your turn. Katie, Kate, Megan, Louisa, and Amelia. Thank you.
Thanks so much, Harold. What an amazing presentation to follow. So hopefully we can do it justice. Welcome to our session, Money in the Question Bank, Designing and Testing Edits for LIHEAP Applications. My name is Amelia Delio Gundape, and I'm a Presidential Innovation Fellow and a product lead on this project. I'd like to start us out by introducing my teammates. First, we have Kate Saul, who's a product designer at the HHS, at Digital Services at HHS. She'll be one of our speakers. We also have Katie Green, who's the Chief of Staff at HHS Administration for Children and Families in the Office of Community Services. Louisa Scholler works with Kate Saul as a service designer, and Megan Meadows works with Katie Green as the Director of Division of Energy and Assistance at HHS in Administration of Children and Families, Office of Community Services. Megan, can you help the audience understand a bit more about what LIHEAP actually is? And then we'll talk a bit about what problem we are trying to solve and what makes the problem so challenging for this particular program.
Absolutely. Thanks so much, Amelia. So the Low Income Home Energy Assistance Program, or LIHEAP, is a federally funded program available to states, tribes, and territories. So the program can provide home heating and cooling assistance in usually over to 5 million households with low income. The program can also provide weatherization and minor energy-related home repairs as well. LIHEAP is a block grant, which means there's a lot of inherent flexibility when it comes to program administration, which is one of the challenges. LIHEAP grant recipients are not required to administer their program in the same manner in each state and are also not required to use specific forms for households to apply for assistance. So for this project, it was really important for us to be able to ensure that we were designing a template that could be adaptable to meet local needs and also ensure that we were very clear in our communications that this was a template and not a required federal form to be used. So as we transition to talk a little bit more about some of the problems to be solved, in addition to differing program administrations throughout the country, some other problem areas that we were striving to address with this template were based on feedback that we received from our grant recipients. So they shared with us that they really just didn't know where to begin when designing a form or an application for their customers. Grant recipients shared they just didn't have the capacity to create a new template, which led to a sort of a checkbox approach to assistance instead of a thought out customer-centric approach to service. And then other areas that when we were reviewing some of these forms, we found them to be overly complicated, very lengthy, and designed without input from the customer. I'll turn it back to you, Amelia, to talk a little bit about the approach.
Yeah, I want to give Kate an opportunity to share more about the approach. Can you talk about talk to the audience a bit about the approach the team took to solve this problem?
Yeah, I'd be happy to. As you can see here, we started this endeavor by doing a landscape analysis and desk research. And this took the form of reviewing applications from 14 different states, tribes, territories, and counties to develop an understanding of the core questions that grant recipients are asking their customers. So basically, what is the key information needed for grant recipients to determine whether customers are eligible for LIHEAP benefits? We chose 14 just as a starting point, and we were able to find some really good trends in terms of the questions asked. But if we hadn't identified those trends, we definitely would have expanded our analysis. We also wanted to see if there are any trends in terms of language use, terminology, information architecture, and design choices across forms. Because as Megan mentioned, there's a huge diversity of forms out there. There's not one required document. So just wanted to do some research to see what trends we could surface, and also to make sure that we incorporated the successful aspects of forms to acknowledge all the good work that grant recipients have already done. So we didn't want to lose that work. Next, we created a taxonomy or a controlled vocabulary based on the language we saw across the forms we surveyed. So we identified different languages, household information, tribal information, provider info, energy sources, income information. I think those are all the categories from the forms we reviewed. And we wrote plain language definitions for terms within those categories. So this will really enable us to use content consistently, not only within our question bank, but it can also be a really great resource for other LIHEAP related content. So any sort of web content, call center scripts, really anything that incorporates this specific terminology. Our next step was to create the information architecture for the question bank. So really the hierarchy of information we're presenting. I mentioned that we came up with common questions across the different forms. What we did once we had the set of key questions was to group them thematically and then do a card sort to identify, basically which questions belonged in which groups. We then ordered the question groupings in a manner that makes sense to customers. So basically we started with the easiest questions first, personal information, contact information, things that people don't typically have difficulty answering, and then moved into more difficult questions such as heat and power sources and income related questions. Our reasoning here was we want to ease customers into the process of completing this application, not scare them away right from the outset. And now I'll hand over to oh, sorry, one more. We also rewrote all of our application questions in plain language. That's been a really big emphasis of ours. And so we tried to eliminate program-specific terminology, jargon, legal terminology wherever we could. When we weren't able to eliminate that language, we actually provided contextual help. So some help text, parenthetical definitions, things of that nature, just so the user doesn't have to navigate away from the form to learn more about some of these core concepts. And as is common with our form redesigns, we incorporated a friendly and welcoming tone just to try to put the customer at ease during the somewhat emotionally fraught experience of completing a benefits application. So now I'll hand over to Megan to talk a little bit more about our research approach.
Yeah, so the last phase in this approach to the process, we wanted to be very strategic and engaging stakeholders to receive feedback. So we started with meeting with federal staff that had a varying perspective and previous experience. We also then met with grant recipients, which included our tribal grant recipients. We then met with local administrators or sub-grant recipients, and then also met in person and virtually with previous LIHEAP customers. So receiving this feedback was key to not only understanding what was federally required and what would be helpful in program administration, but it was also key to understanding from a customer perspective what was confusing, what felt repetitive, or what could be stated in a more simple way to not cause additional stress on a already stressful situation that our customers may have been experiencing. And Kate will share some of those specific examples when we take a look at the form here in a little bit. Amelia, I'll turn it back to you.
Thanks. Katie, what was the intended impact of the work? What kind of success metrics did the team outline for this project?
Sure. Thanks, Amelia. So our primary goal here was really to improve the LIHEAP customer experience by providing our grant recipients with a tool that they can use to streamline their application and incorporate plain language. And so, as Megan mentioned, by incorporating that user feedback from eligible households in this process, we can provide our grant recipients with something right out the gate that's already been tested and vetted by their target population and really centers the user experience of the folks that are going to be interacting with and filling out these applications. Another key goal here was to create a model that LIHEAP grant recipients can use either in full or in part. And so this template can be modified to meet the specific needs of individual grant recipients, to account for differences in the heating and cooling types in their communities, as well as the different heating and cooling needs and variance in common housing types. We also know that our grant recipients are in different places with regard to IT capacity and how easy or difficult it is for them to make IT changes. And so we wanted something that is modular and that they can pull pieces from, or the whole thing if they have the capacity to do that. This model application also, it was important for us that it included everything that's required for federal reporting. So we've taken off that burden from grant recipients. This form will come to them with everything that they will need to report up to us in their other their federal reports in terms of the applicant households. So some of the key metrics then, of course, reduction in beneficiary confusion, and increased efficiency for the grant recipients in terms of their reporting. For supporting metrics, you can see them on the screen here. We're looking at things like increased return form rate, reduced call centers related to confusion, as well as increased reporting accuracy from our grant recipients. Before I turn it back to Amelia, I'll just double down on this piece that we're really not defining success here by the number of grant recipients that adopt, do away completely with their old model or their old application and adopt this full sale. It is, we think a success if grant recipients pull certain plain language changes or change the wording or the segmenting of questions so that it's more accessible and easy for folks to understand it and get through. We see that as a success. So I'll turn it back to Amelia.
Thanks, Katie. Yeah, it's really about easing the burden. Now probably the part that y'all have all been waiting for. Let's actually see what we created. Kate, can you walk us through the actual end product?
Yeah, totally. I'm happy to share some highlights from our prototype. So just before we scroll through, I wanted to share a quick note on prototype design. So you'll see this is in Google Docs. And we actually did that deliberately for a few reasons. One, it's software we'll have access to. There is no barrier to entry there. But more importantly, as Megan said, we're still in the process of usability testing this prototype with users and users or recipients. And we found that if there's a lower fidelity prototype, research participants can feel more comfortable offering more critical feedback or being more candid with their responses, which in turn helps us continue to improve our product. So with that said, just like to highlight a few of the changes that we made, or a few of the updates we made. You can see here we're on the instruction sheet. We start off with a very clear form title and a language accessibility statement so that folks can get the form in the language they need. You'll also see that there is a statement just describing what LIHEAP is and what it offers, so people have a very clear sense of the benefits that they might get upon completing this application. And then following that, we have a very clearly defined list of steps that the user needs to take to complete in order to submit this application, including the documentation they need. That's something that we've heard customers often struggle with, not knowing the documentation and then starting the form, getting confused or frustrated, and then moving on. So wanted to have a very clear, concise instruction sheet. Next, want to talk about the race and ethnicity section. this is an example where we got some really good feedback from one of our customers about consolidating questions for concision. So previously, this section had a separate question asking if the customer identified as Native American or Alaska Native. And one of the customers we spoke to during usability testing said, this feels redundant. It feels like this could be combined with the previous question. And so we made that change just to try to keep the form as concise as we possibly could. Next, I'd like to call out the energy assistance section. Yep, here we go. So you can see here, there's a robust list of residences, and actually in the next section, there's a very comprehensive list of energy sources. And so when we actually eventually publish this question bank, we're going to provide guidance to grant recipients that this is very customizable. There's no need for them to include all of the energy sources or all of the residence types, but we want to provide them with enough options so that they can create the form to reflect local regulations and contextual information. But just want to provide some guidance to grant recipients that this is entirely customizable. Next, I'd like to touch on the income section. So one thing that we've heard, not just with this project, but also other benefits modernization projects that our team has worked on, is that people really struggle with providing income-related information. There's a lot of specific terminology. Oftentimes, there's the need to provide or to reference documentation. So we really spent a lot of time on this section and crafting the wording here. One really great example, again, of user feedback that we got during usability testing is the use of income before taxes instead of gross income. That was a change that we implemented and got really positive feedback from some of our research participants. And if we scroll down just a little bit, I also want to call out the work we did in the self-employment section. A lot of the work we did here drew on our past experience with unemployment insurance modernization and also Medicaid application modernization. We've done pretty deep testing of the language for self-employment because it can be a very vague concept, or a concept that encompasses a lot of different smaller concepts. So people have a general sense of what self-employment is, but sometimes wonder whether their particular form of employment counts. So our approach here was to include a lot of different and diverse examples to give people a pretty clear picture or a fuller picture of what self-employment might include. And so far, we've gotten really positive feedback on this from our research participants. And then last but not least, I do want to touch on the signature page, which, okay, there we are. So we've gotten a lot of feedback that sometimes customers will overlook the signature page. They will not sign their initial application. And then when they send it in, it won't be processed because, it needs to be signed in order to be processed. So the result is that a lot of people who complete the application miss out on potentially getting benefits they're eligible for simply because they haven't signed the form. And in order to hopefully prevent this from happening, we really wanted to have a visually prominent signature box. You can see there's an arrow there just pointing to that space, just so that folks who take the time to complete the application can get the benefits they need. So just a few examples from our prototype, and I'll hand it back to you, Amelia.
Thanks, Kate. Really great to see all the hard work in that demo there. I'm probably biased, but that was some great work by the team. Louisa, can you share some tips and tricks that made this team successful?
Of course. So one of the primary tenets of our work here is that we were building with and not for. And one of the groups we were building with were our partners at OCF. And so Megan and Katie have been incredible collaborators on this. And we have met weekly with them through every step of this project. And that collaboration has allowed us to play to each of our strengths. So for our team, conducting the design and plain language review has allowed us to facilitate those activities. And Megan and Katie were also able to step in with their program expertise and their connections. So getting in touch with all of these stakeholder groups so that we could chat with them, hold user testing sessions, all of that would not have been possible without their help. And so we took a very deep collaboration approach that only served to benefit the project itself. And the testing also helped ensure that our our work was truly reflective of people's perceptions of the work and the prototype we had built. And so on the lines of what we learned from this project, a couple of selling points for this modular content approach have already been touched on a bit, but I want to make them more explicit. So as Katie alluded to earlier, the idea behind modular content is that people can take bits and pieces of what they want or need and can update them accordingly, can update those sections of a form accordingly. And so making updates is seen as more manageable when you can do them in chunks. Similarly, the baseline of what is federally required is already incorporated, so we can remove any questions of, oh, do we need to ask this? What about this piece? Users can rest in the assurance that they have everything that they need to cover already in that form. And finally, tailoring content is more localized. So again, people can make edits more quickly and to their local needs.
Any resources the team used along the way that you can share?
Sure. So there are a lot of content resources related to plain language, including from 18F, plainlanguage.gov. DOL has also built an incredible plain language site. And as Kate was mentioning earlier, the work of creating a lexicon, so identifying terms that are commonly used but also commonly confusing, that can be helpful for any benefits related program or other government related terminology. So having that dictionary and easily defined terms in plain language can be of help for any other project and also developing other additional content. So those are places we'd refer you to start, but yeah.
Thanks, Lisa, and thanks, team, for sharing an example of how plain language can help states, tribes, territories improve their LIHEAP applications. Thanks, everyone, for listening. If y'all have any questions, feedback, want to partner with us, feel free to send us an email. We are still actively testing our prototype, as Kate mentioned, so if you work with the LIHEAP program and you have access to folks who are using LIHEAP customers, please reach out to us. We would love to continue to validate our work. And if you need to update your form, we would also love to work with you as well. So that kind of wraps up our presentation, and I will turn it back over for the Q&A portion of this.
Wonderful. Thank you so much for that. This is very close to my heart. Where in my project, the Opportunity Project for Cities, we're doing exactly this in Miami-Dade County, and we actually reached out to Louisa, I believe, for support on this. So very relevant and very interesting work. Hopefully we can get people smoother pathways to getting the benefits that they need. So now it's time for your questions. Please add yours to the Q&A if you haven't already. Upvote your favorites so that we can answer the ones with the most interest. We'll get to as many as we can in the next 9 minutes or so. So the first question I have is for the kinship team. How many more caregivers do you anticipate being able to get licensed under these standards?
I love that question, and I like the answer too. So I think I mentioned during the presentation that right now only 25% of our kinship caregivers for children who are in foster care are licensed. And moving forward, we are going to be able to license very close to 100% of our kinship caregivers. There are very few reasons, there are a few barriers that will prevent that from happening. So we are truly looking. The goal is 100%, and I would say 99%, 100% is truly possible because the process is so much better and so much smoother and can truly be done in a day, thanks to the thoroughness of the forms and the way that we were able to get them developed.
Very good. Thank you. Next question for the same team. How many agency workers responded? How have agency workers responded to this new form?
So they have, again, we went from 30 forms down to 3. So, and the most incredible thing about being able to pilot this process has been the feedback that, you know, we've never really had a chance to be so thoughtful and to road test a form to see how it would look in practice. And so this whole process has really, really been incredible for us. And my team took it very seriously. I mean, everything down to, you know, moving this around there, and this is not dark enough when you know, so being able to provide that kind of feedback, they took it very seriously. And on the state level, they heard it and implemented those great and wonderful recommendations into the forms.
Wonderful. We're going to move over into the LIHEAP team. So Charlotte says she used to work at the Connecticut DSS and always wished there were clearer information for clients about how LIHEAP actually works. It's understandably super surprising to folks that you apply in the fall and then have to wait months and months to actually get money in your account. Beyond updating the form, have you built resources to help people understand how the benefit works and what to expect?
So it's a great question. And so what I mentioned early in the presentation is LIHEAP as a block grant means that no state, tribe, territory runs their program the same way. And so to help address this and again, to make sure our form was adaptable to each local need, we're going to create a guidance document that goes along with our application. That's going to encourage you to be thoughtful about what you include within your application. And it might be very simple things like if your area does not have bulk fuel available, remove that from your list of fuel types so that you don't cause confusion for your customers. But you know, when we were interviewing customers, that was an area where they were like, can you just tell me the why behind why you need some of this information? And so we took that feedback and built out some of the reasoning behind why we were asking some of these questions. And so that's what we're going to include in some of the guidance documents so that each state, each area can be thoughtful about that when they potentially go to implement this form within their communities.
Wonderful. Thank you. What type of promotion for the LIHEAP team, what type of promotional awareness template and reporting is supported by the template and program? Can grant recipients draw on any federal methods, approaches, or sources to report, analyze, and improve services? Oh,
Sorry about that. I was struggling to come off mute. So yes, there's we have a and I hope this is answering the question, but in addition to the model application, so states, as Megan mentioned, you know, as a block grant, states, tribes, territories have to apply for the funding, and they outline in a model plan to us how they plan to conduct outreach in the given fiscal year for which they get funding, and then they also have to hold public hearings where they get feedback from grant recipients. And so one of the things that we're going to do together with this model application, and what we always do when we receive the model plans and review those for funding, is to you know, look at where this outreach is happening, where grant recipients might have ways that they can streamline you know, and improve their outreach, as well as the application. So we'll, through ongoing technical assistance and regional calls and guidance, really encourage the uptake of the model application where appropriate.
Wonderful. I think I have time for one or two more for either or both teams. How did testing and iterating fit into your existing bureaucratic processes? For example, the requirement that docs are passed through layers of approval before it's released.
Yeah, I'm happy to hop in and share a little bit more about our research process. I think, fortunately, for our team, we've got really great PRA folks who are able to quickly clear any sort of usability testing scripts or other research artifacts. I think also just developing a really strong, reliable research cadence can help mitigate the sense of, you know, frustration that can come with working within a bureaucracy. But I was going to say, yeah, we have a steady recruiting stream. We work with PRA to get things approved as quickly as possible. And yeah, I was going to say we haven't faced too many challenges, but I think that also speaks to our team's experience working in the federal sphere. Folks on our team, I don't know how many combined years of knowledge we have, but we've spent a lot of time working, doing research within federal agencies or in consultancies adjacent to those. So I think, having that background and that experience also bolsters our sense of patience and willingness to work within the confines of bureaucracy.
For us, it was a little bit different. And I'm not going to say it took an act of God, but it definitely did take a signature from the Secretary of Child Welfare to be able to, because there's existing laws that govern how we license families, and for us to be able to modify those processes with those existing laws during the pilot meant that we needed special permission to be able to do that and to be able to use these forms in line with the new practice. So we had started a long time ago with the understanding that, again, the experience for our kin families just is not in line with the messaging and what we knew to be true. And so we have been working on our kin process for a while now. Our director set in motion the idea that let us pilot this. And so even though we knew all the modifications were coming, she went to the secretary and asked for him to, to modify the process before it becomes state law, which again is happening like any day now. The 9th, I think it goes live. And so that is so exciting for us. And so it really was something that we needed special permission to do. And then the training that, Becky and I kind of took on ourselves because it was something new that we were exploring. But we really wanted to make these changes that were going to be both very thoughtful and sustainable and create a consistent practice throughout the state of Maryland.
Wonderful. I think that takes us to time, so I'm going to stop there, but that doesn't mean the conversation has to stop here. Let's give our speakers a big round of applause. Thank you, speakers, for sharing your work with us. Next up, we have the instant networking until 3:45 Eastern, then the closing keynotes in the main stage. With that, we're going to end the stream, but thank you again to our speakers and thank you for joining us. Feel free to look out for your speakers in the speakers section or at other opportunities during the programming. Talk soon, y'all.